6.3, presentation of Lake County Health Services monthly update, and it looks like we have our director, Jonathan Portney.
Dr. Karl Sporer.
And
Dr. Karl Sporer. I'm going to give a overview of this gentleman's accolades. First, I would like to welcome Supervisor Green. We're happy to have you here. Thank you for filling a seat and representing the county, helping us move forward in the much-needed direction with the rest of the Board of Supervisors. And also, I want to give appreciation to those tuning in from the community. I'm happy you're here because your presence here helps not only keep us accountable, but help us move forward in the right direction.
Director Portney, would you like to sit up at the table, or are you fine right there? It's up to you.
I'm okay.
Okay.
I'm going to try to keep it short because if I sit down, we could be here till lunch. So every other month, we try to give a public health update to the community. There's a lot to update with a little bit of time. So today, I would like to introduce Dr. Karl Sporer to provide the public health update to address some of the questions that were brought up in previous board meetings around case rate, tier, and other elements around health affecting our community. Without further ado, my name is Jonathan Portney. I'm the director of the Health Services Department, and I'm here today to introduce our interim public health director, Dr. Karl Sporer. Dr. Karl Sporer, your CV and your resume was about 32 pages, so I'm going to try to highlight just a few. Dr. Karl Sporer is a UCSF School of Medicine clinical professor in emergency medicine, UCSF School of Medicine professor at Emirates, and EMS medical director previously and currently in Alameda EMSA. So without further ado, I'd like to introduce the board and the community to our interim public health director, Dr. Karl Sporer.
Thank you for the opportunity. Again, congratulations, Supervisor Green. My background is as an emergency physician, and I've been in public emergency departments in New York, New Orleans, and San Francisco for 20 years. Also worked for about 25 years with county governments and EMS and disaster, so I've got that portion of it down pretty well. I'm trying to retire from Alameda County and to my home in Sonoma, where I drove from this morning, so we're fairly local. And my public health background is fairly thin, other than like everyone else, one of you, we all pivoted toward COVID in the last 3 years. I did nothing in my entire office toward working with COVID and vaccinations and testing over the last few years. So I've learned quite a bit about public health in that process. I have the capable help of these guys behind me for lots of questions and all the multiple meetings that CDPH seems to do with large frequency and lengthiness. So thank you for this opportunity. So with that background, I'm interim, and we'll see how that goes. And I know that you're doing a search, and good luck on that. I hope that you find a good public health officer that's local and will be able to help you full-time. But between now and then, I'm here to serve with you. I'm going to be very brief about our public health response, and anything more, we're probably going to need some help from Jonathan. But as you recognize right now, COVID is waning at this moment. It's low. We're very fortunate. Should knock on wood or formica, and we'll see how that goes. We're concerned about a wave this year. I looked yesterday at my Walgreens to try to get an appointment to get my booster, and it's 5 days out before the first appointment. So people seem to be getting it, and that's what we would recommend everyone to do. Also, to go ahead and access your flu vaccine at the same time. We are low, considered in the state of DPH standards, and we're not required masking at this point, and we'll see how that changes over time. Influenza will be an issue we worry about. We haven't had any other significant variants coming from the East Coast or from Europe, but we expect probably an increase this winter as everyone gathers for the holidays. Other diseases seem to be under reasonable control at this point. We've had this one episode where we looked at the wastewater treatment monitoring of COVID. We had like a 10% increase in one of the 3 wastewater treatments. We'll watch that, see where that goes, and see if there's a trend. I'd be happy to take any questions that you have.
Not seeing any questions. No,
It's
Supervisor.
just really nice to meet you.
Oh, good. And it's nice to be here. I think being here in person is always very, very useful.
Yeah, appreciate you coming.
Okay.
Supervisor Sabatier, and then...
I just wanted to state that I keep track of all the data from CDPH
Yeah,
coming out.
good for you.
We've been looking really good for a while,
Yes.
which is helpful not just in what's going on, but our schools, with teachers not having to leave and having no substitutes, with every business to not have to be out for 5 days or more. I think it's just really helpful to see those numbers dwindling. That means that we're all being more productive, being more able to participate in the things we want to participate in. So all of it is looking good to me, and hopefully it'll remain where that is. But what happens, happens. We'll see. But thank you very much for being here, and I know I've been in a couple other meetings with you as well, and happy to see you interact with those groups and those regional groups that we're a part of.
Good. Today, I hope to meet with some of the fire chiefs and some of the, at the hospitals, so I have a better understanding of the location and what's going on here. Thank you.
Supervisor Green, did you have a...
Yeah, just very welcome, and not today, and you're interim, and I don't necessarily want to dump any homework on you, and of course, the board has to have consensus, but I just came up from line staff. I work in county workplaces. This is a county workplace, too. I'm interested, as this evolves, and I know COVID-19 not your primary thing, but somewhere between shutdown and total open and low to high to medium risk, there's some evolving understanding of aerosol transmissible diseases and how we can harden our workplaces, through increased ventilation, through kind of distancing of work sites and stuff like that. I'm interested to hear about that stuff as that information filters in, just because we're going to be constantly evolving our own workplace practices, downsizing, upsizing. But I think the one thing I haven't heard yet is kind of some understanding of how we can create better, more resilient workplaces in terms of ATDs. So that's a particular interest of mine, and I'm just would love to hear some additional information about that if it ever filters down from CDPH or wherever you guys get your info from.
Thank you, Supervisor.
Thank you.
I do have another question. I had pulled the COVID-19 public health emergency, and I know that our governor is planning ahead of time to go ahead and cancel that in February. I don't know if there's some ifs, ands, or buts that are aligned with that. Is it conditional? We'll find out in February if it is or not. But just kind of curious as to your thoughts on our continuing that. We still have our sheriff's emergency, which is allows us to continue the financial aspect of it. I see the public health portion of it as being giving us a capability to create our own rules and mandates and regulations, which we have none. And at one point, we just said we're aligning with the state, which now the state is aligning a little bit more with CDC. Everything's just getting looser and looser. What would your professional suggestion be? Is it necessary to keep it? Is it not a necessary tool at this moment in time since it hasn't been used for over 6 months? Just kind of curious since we had the conversation and you weren't available for that part of the conversation.
I think that actually working with the CDC and the CDPH guidelines is probably where we should go in the future. Early on in this pandemic, CDC was always like about 4 months behind. And we had to make things up along the way. That was very problematic. And then they came around and we had to rejigger it the third time. So sticking with other August resources is probably useful. And so I think you have an existing local emergency and you're probably going to need to rescind that soon, or think about how we would manage that between now and February.
Okay.
All right. With that, thank you, Dr. Sporer. Welcome aboard for coming in and helping us out. And we'll open it up to the public briefly.
I do have one more.
Sure.
I just wanted to go back to Mr. Portney. Since there was a comment made in the public comment about the syringe exchange program, and I know that you brought to us a conversation about the syringe exchange program. There's been some work in the background about an MOU or a contract to try to enhance the relationship or the ability to maybe manage that relationship. Do we know where we're at with that at this moment in time?
Thank you for the question, and the MOU is still pending, and due to staff turnover, the process is in development. On November 11th, we have our Director of Nursing starting, who's going to be able to provide better oversight and management of clean needle exchange programs or syringe exchange programs. So it is still pending, and after review and onboarding of the Director of Nursing, we'll be able to report back with our success.
Thank you.
All right. Just making sure. If there's anyone from the public that would like to comment, and it looks like we have somebody.
Well, I'm Greg Bianchini, and with Jonathan,
Greg, you can just say it.
okay,
Yeah.
okay, with the
MOU.
MOU, I'm not sure really what that is, but maybe I could meet with you at some point with the needle exchange program. I can do that. So,
The door is
thank-
always open, and I'll be at the office all afternoon. By all means, come through.
Okay.
The idea of around an MOU is it's a memorandum of understanding, and it's somewhat like a mutual aid agreement where we set roles and expectations around a potential collaborative working relationship so that we can accomplish goals and objectives together. But by all means, come by the health department. I would like to hear your ideas around
Okay.
how we can make not only our department, but the system stronger.
So there isn't an MOU in,
Pending. MOU.
right now, though, with any positive change?
There is not.
Wow, okay. All right, thank you.
Thank you. Come on up and state your name for the record. I see you have a, come on up.
I am Joan Moss. I'm a journalist. I learned early to get all sides of the story. And I want to mention a paper called Gateway Pundit. And there's an alternative movement going on. I hope that you both are aware of it. About Anthony Fauci and his relationship with the press. And he has resigned and he's going through a trial. Anthony Fauci. Thank you.
Thank you, Joan. Any other public input? And I'm not seeing any other folks coming to the microphone or any hands up in Zoom. So I will close this item as it is